TCAs, antidepressant. For this we have amitriptyline with BPH and dyes. This is IMI and AMIs, so imipramine, the prototype for depression. It blocks serotonin and norepinephrine. The side effect is orthostatic hypotension and urinary retention. Be cautious with patients that have BPH. Adverse effect is cardiac toxicity and suicide risk. SSRIs. This is fluoxetine. The brand name is Prozac. These are your ENs and PRAMs. They block serotonin. The side effect is sexual dysfunction. The adverse effect is serotonin syndrome. That's 911. Antipsychotics. For haloperidol, we have it's dope playing Halo with Mike Epps. He's in MS. So haloperidol. The brand name is Haldol. This alters dopamine in the CNS. The side effects are prolonged QT intervals and orthostatic hypotension. The adverse effect is EPS and NMS. All right, so chlorpromazine. This is Thorazine, the brand name. It is for the suppression of emesis and intractable hiccups. The side effect is orthostatic hypotension, urinary retention, and EPS. Then we have clozapine. The brand name is Clozaril. So for this one we have Aunt Cy is a crazy schizo who takes clozapine and thinks her white blood tastes like sugar. Clozapine blocks serotonin and dopamine. The side effects are weight gain, hyperlipidemia, and diabetes. The adverse effect is agranulocytosis, seizures, and myocarditis. Now on to mood stabilizers. For valproic acid, we have 50 Valley Girls go GABA over baby HTP. So valproic acid increases GABA. The side effects are thrombocytopenia, hepatotoxicity, and pancreatitis. The adverse effect is liver failure, and it's heterogenic. And the HTP is, Lithium is milky salt mania. Think sodium for lithium. The side effects are nephrotoxicity, polyuria, and electrolyte imbalance. The adverse effect is lithium toxicity, and the range is 0.8 to 1.4. MAOIs. Phenelzine, the brand name is Nardil. Another generic name is isocarboxide. This is a CNS stimulant. The side effects are orthostatic hypotension. The adverse effect is hypertensive crisis. All right, now we're on to Parkinson's. The medication is levodopa. The brand name, one of them anyways, is duodopa. This increases dopamine in the CNS. The side effect is urine and sweat discoloration. This is normal, and orthostatic hypotension. The adverse effect is dyskinesia and acute Parkinsonism. Another one is pramipexole. This is for late-stage Parkinson's. The side effects are restless leg syndrome and sleep disturbances. Now we're on to Alzheimer's. The medication is donepezil. The brand name is Aricept. This increases ACH. The side effect is sludge. Think diarrhea. Adverse effect is the killer bees and the cholinergic crisis. The next one for Alzheimer's is memantine. This brand name is Namenda. It works on glutamate with NMDA. The side effect is dizziness, headache, and diarrhea. The adverse effect is Stevens-Johnson syndrome. Now we're on to anticonvulsants. We're going to think Akon has drunken crazy eyes, smokes 10 to 20 cigarettes with hairy teeth. That's for phenytoin. The brand name is Dilantin. They work on seizures. The side effect is gingival hyperplasia and hirsutism. The adverse effect is nystagmus. The anticonvulsants. Dad loves carbs. He puts salty baby liver on BLT. This is for oxcarbazepine. The brand name is Oxtellar. This is for seizures. The side effect is dizziness, ataxia, and drowsiness. The adverse effect is Stevens-Johnson syndrome. And the BLT is baseline thyroid. You need that. And the therapeutic range is 12 to 30. CNS stimulants. This is methylphenidate. The brand name is Ritalin. So we came up with, I depend on you, Al. I can't eat, can't sleep after 4 p.m. without you. The side effects are insomnia, weight loss, and dysrhythmia. The adverse effect is dependence, and the reversal agent is abracadabra, alprazolam. CNS stimulants also include amphetamines. Benzos. All right, so Sleepy Benny Pamalam abused GABA and got the flu. So these are your PAMs and LAMs. They enhance GABA. They work to treat anxiety, seizures, muscle spasms, and alcohol withdrawal. The side effects are sedation and respiratory depression. The adverse effect is dependence, and the antidote is flumazenil. Muscle relaxants. Think CBD, C dry spasms, BPH, D liver. The medications for this is cyclobenzaprine. The brand name is Flexeril. This treats muscle spasms. The side effects are anticholinergic and cardiac dysrhythmia. Adverse effects is serotonin syndrome. Now baclofen. The brand name is Gabapentin. This treats muscle spasticity. The side effect is psychosis, confusion, and GI urinary retention. Think BPH. There is no antidote, and I don't think it's psychosis. It's something else, psychotic something. I just didn't write it. And the adverse effect is overdose potential. The last one for muscle relaxants is dantrolene. The brand name is Dantrium. When you see dantrolene, think Dan. This equals NMS and MH, which is malignant hyperthermia. This treats mass spasticity and suppresses calcium from the sarcoplasmic reticulum. The side effects are muscle weakness and hepatotoxicity. MS. This is interferon beta. So the mnemonic we did for that is interferon beta, immune attacks, ataxia, liver. So interferon beta decreases attacks. Side effects are ataxia. And the adverse effect is suicidal ideations. The liver part is the labs. MS, mitoxantrone, mitoharm veins in baby, acute leukemia. So mitoxantrone decreases autoimmune destruction of myelin. The side effects are vesicant, teratogenic, and cardiotoxicity. The adverse effect is acute leukemia. Now we're on to SNRIs. Vinny Don't Stop Baby's blood pressure. This is for venlafaxine. It blocks serotonin. The side effects are anorexia and diastolic hypertension. The adverse effect is neonatal withdrawal syndrome for venlafaxine. So next one we have is bupropion. Don't headbang and eat during sex while on bupropion. Bupropion is for major depressive disorder. The side effects are increased sexual desire and anorexia. The adverse effects are suicidal ideations in children. All right, so Z's for sleepwalking. We're going to think zolpidem and imidazopyridine. So for zolpidem, the brand name is Ambien. This treats insomnia. The side effects are respiratory depression. The adverse effects are sleepwalking. And then we have finally buspirone. Elvis got off the bus and died on the toilet with buspirone. Anxiety, OCD, and PTSD is what it treats. The side effects are... Oh my God, you scared me. The side effects are constipation and the adverse effects are suicide.